So, Angie, even though it's 2025, we're still using fax in a healthcare setting. So, what does fax organization typically look like for your average health system?
Terrible, honestly. Faxes often get lost in shared inboxes, paper stacks. There's no way to confirm receipt status or follow ups. There's super unclear ROI on how much money is coming in through these orders or referrals, and how many patients are getting lost in not getting acquired when they should be. When I talk to clinics and staff, they often have this like sad look of like, I don't know why we're doing it this way. This is just how it's always been. And when I show them this solution, they're like, I didn't even know we could do this.
So, I imagine all of that creates a pretty messy downstream effect for patients who are waiting for care, but also likely for the referring provider who has no idea what happened to the patient that they referred. Is there an easy way to create more visibility?
It's definitely not easy for everyone that should be tracking their faxes better. FaxTransform makes it way easy for you, both on just setup configuration, making sure your processes stay the same until you want to change them, and then also provides visibility into what's actually happening. This is our FaxTransform automation workflow builder. Unlike a PDF or a document, this won't change unless you go in and make a change for you, and it can process and scale to however many faxes are coming in indefinitely. We have 4 different basic workflows here. One is a scheduling workflow. We'll go ahead and create a referral shell. We'll create a referral in Luma, get that patient to schedule their appointment online. There's an ordering workflow here where we might attach to an order or create a new order if one doesn't already exist. There's an acknowledgement workflow where maybe we need to send an in-basket message to a provider to let them know an extra result is in the patient's chart so they don't have to ask for that again. And then the document upload for discharge summaries, consult notes, where we don't want to bother anybody to have to look at it, but it's in the patient's chart just in case somebody needs it. If we open up the details of this configuration, we can see all of these different document types that are automatically updated based on what we pull out of your EHR. And down below, we can see how this workflow gets into action. And so things like, what is action type? We're uploading that document into the EHR. We're marking it as unreviewed so that somebody like a provider or a nursing pool needs to review this on the other end to acknowledge that it has been received. And you can even customize which folders to put them in designated places so that the end user in the EHR is not going to even notice a difference that whether a human or a Spike AI accomplished this workflow. Okay, so what we can see here is an example fax from one of our early access customers who have launched FaxTransform. So this is their data over just really a month and a half of time. And so we can see here there were over 20,000 faxes processed. Their backlog is down to just 1,000 faxes when we started with over 30,000 in their backlog altogether. We're down to 93.8% successfully extracted fields. This means that our AI is successfully extracting close to 100% of all the fields that we're pulling from that fax. And then we're down to a minute per process each individual fax end to end. Not only can we see how the faxes are being processed and at what rate and the accuracy, but down below we can see visibility into faxes processed over time. Which document types are causing your staff the most pain, causing your staff the most time each day to day. And then down below you can even see how we optimize over time. And so based on the percentage of fields processed accurately per document type, us and the Luma team can continue to help optimize different document types to make sure we get even better accuracy over time.
That's really incredible. Thank you for sharing with us, Angie. Click the link to learn more about how FaxTransform can help your organization.